everybody. I am Diana from the Knee Zone, and I'm joined today by my husband and the amazing Dr. Raj Sinha.
Hello, everybody.
Dave, thank you. This is so great. Thanks, Dave. Thanks for doing this. Let's see here. Oh, just 52 days post-op and doing great. Yay, that's awesome. That's awesome. Okay, here's an actual question, but thanks for the shout out. Love it. Okay, this is for you because I know you love this question. Can you address robotic knee surgery? I've heard recovery is faster. I've been told I need both done and I'm terrified. So hopefully you were here earlier when we were talking about fear, but I know you love to talk robot stuff. So,
first thing I would say is if you're being told you need both knee replacements done, don't feel obligated to get both done at the same time. It's okay to do one at a time.
Yeah, you don't need to be mean.
Yeah, there's literature all over the place about what's better, what's worse. And my interpretation of all that literature is that it's a wash. Whether you do one at a time or do both at the same time, I don't think it matters. There are very specific instances where you should do both at the same time, but they're few and far between. Okay, robotic surgery. I was the fourth surgeon in this country to ever do robotic.
In the United States.
Sorry, in this country, sorry.
Well, not everyone knows. I mean, we sound pretty American.
In this country of Texas. No, I was the fourth surgeon in the United States to do robotic knee surgery. That was back in 2007. How long ago was that? 19 years ago. Those were partial knee replacements, and it was really cool technology. I enjoyed doing it. It taught me a lot about my own tendencies and biases. Now, when surgeons say robotic knee replacement allows patients to recover faster, they're talking about compared to the same implant with conventional instruments. However, when you throw in the whole pain management protocol, it kind of washes everything out. So the robot is a great tool, gives the surgeon real-time feedback. It's not critical. I always say pick a good surgeon first and let them do the operation the way they do it best.
Yeah. Patricia, we have a lot. If you're interested, like deep dive in our book, Knee Replacement Secrets, you can get it on Amazon. Raj talks a lot about the history of surgery, the robot, all of that, more than we can do today here, but there's a lot of information in there. And so definitely it'll help you get over this fear factor that you're also experiencing, because it's normal to feel fear. It's a big deal. Dave actually did have a question. I knew I'd seen that earlier. I was like, oh, thanks for the love. Okay. This is I'm going to remind you, I think Dave said he was 52 days out on Instagram. I couldn't straighten my knee pre-op and it continues. So you should be on a goal right now, a big goal to get that leg straight, Dave. And we're going to talk about, again, what you need to be doing to ensure it was straight. But just because he wasn't able to get it straight before surgery, I would have thought his surgeon would have told him post-op, like, hey, just so you know, it won't be straight. I mean,
no, I would never say that to a patient.
Right, I know you wouldn't.
If you don't have full extension going into the operations, one of my goals is to have full extension for you before the operation is over. And there are all kinds of things I can do surgically to get you there, and I always do because it's critical. If I don't get you straight at the beginning of the operation, it's going to be really hard for you to get straight afterwards. Now, having said all that, and I'm going to assume your surgeon got you straight, and you kind of fell into that, oh, it feels a little bit better when it's bent situation that we talked about earlier, you still have time to get it straight. Now, at almost 2 months out, simply doing exercises may not be enough. It may be, but you really have to focus on stretching out your hamstrings, and maybe even having somebody push it down on your knee a little bit to stretch out the hamstrings and the back capsule of the knee. Another trick that I have had people do is take 2 tube socks, put a can of soup in each of the socks, tie the socks together, and hang it over your knee when your leg is straight. And that 10 pounds of weight or so just gradually stretches things out. Now, if you get to about 3 months and you're not fully straight, it depends on how close you are to full straight. If you're less than 5 degrees, I wouldn't focus on it. I wouldn't worry about it because with time, you will get to 0. That's what most surgeons experience, is mine included. If you're about 10 or 15, then I'm going to put you in a dynamic splint. That has a spring-loaded, it's a spring-loaded brace, and it's going to stretch out your hamstrings for you.
We're going to say goodbye to you, our friends. We hope to see you next week. If you want something, just drop guide or go to thekneezone.com. Scroll on down, and you can drop and get it right there right away. Thank you all. Thanks for enduring our experiment today.